Now, I want to give you a little case example here as we just get wrapped up today. We had a little girl who come along. Jazz knows these folks because we still see these people at Hoppers Crossing. And this beautiful little girl, she's a vibrant little kid. And she's like any other little 10-year-old to 11-year-old girl. She wants to go and do gymnasium and ballet and all that stuff, with her mates, and that's fine. All good gear. But she comes along and she's got this. And that's how she walks. So she's got a tightness in the gastrocnemius and heel, okay? And she comes walking along with that. And I was asked to look at this child, and so we had to do the gait assessment and watched it and did all that and made our notes and went through the assessment. Now, here was what we had. Loss of lateral flexion to the right, okay? Rotation was normal. This was impaired. This was impaired. This was impaired. So I haven't found it yet. Keep working distally. We got all the way down here and we got to there, and that finger just simply wouldn't rotate. So we had an externally rotated index finger. That was the subluxation. We tested that, we pre-tested that, okay? And the mum and dad are sort of watching like, We pre-tested this and up she went. So I said to Dad, you hold your little girl's finger here. And lateral flexion normalised. Now there's the kicker. We went to her low back and she was locked up in flexion extension, L5S1 and both SI joints. So it's paradoxical kinesiopathology, but it's meaningless for the simple reason that she doesn't have the first step. Exactly right. That's exactly right. No bilaterality. So I went down and I showed this to Mum and to Dad, and she had on this side here, she had weakness in this whole side here. So no matter what muscle you tested, it was weak. And I said to Dad, I wasn't showing off. I was trying to educate Mum and Dad as to what this whole neurology thing's about. And I said, just hold this finger now into that rotation. Just hold it there. Okay, keep your finger just there. I went down. Hip flexors are now strong. The tibialis anterior is now strong. So we adjusted this, got this thing all up and going, and this kid walked across the floor like that with hardly any change in her gait. She then went to gym, and she's doing her gym, and the physio come up and said to Mum, has your little girl had a Botox injection in her? She's got amazing movement there. What happened? Oh, the chiropractor adjusted her finger. One little fella in England, I was with another chiropractor, there's a friend of mine in England, and we were examining this child together, and this child had tracking issues, and the speech therapist came with him. These people think medically, which is fine, that's the way they're trained. This kid had a pisiform. We took this kid's pisiform, it was fun really, I mean I enjoyed it. We took this kid's pisiform, worked our way through it, lateral flexion, worked our way all the way down, got his pisiform. I had the other chiropractor hold this and I went through the tests, and this lady was watching the change in movement. But what blew her away was if we didn't take contact on the pisiform, he couldn't track. If we held the pisiform, he tracked perfectly well. And no, so they don't see that as a possibility. And she sort of looked and she said, can I do that please? Sure, help yourself. So we held the thing and she did this and we took it away and he couldn't track. And she had a black afternoon, So we adjusted this kid's pisiform. Can't you see this? She's laying in bed with her husband who's a GP. And she said, do you know what happened today where I work? I need to tell you. I had a kid who couldn't track at all. So he's ocular nerve. Some chiropractor did something to his wrist and now he tracks. He stops doing it, now he doesn't. Oh, I need to sleep really badly. And she lays down and goes to sleep and really hopes that when she wakes up it was all a bad dream. And you can't do anything that dramatic with the nervous system, but you know what, you can. And the magic of all this is It's almost like another whole horizon that opens up, because you can go into the nervous system and alter the nervous system and make enormous change to the outcome of that patient's life. And in the case of children, some of the changes that occur in 5, 6, 7, 8-year-old children completely affects their educational outcome and their opportunities in life as a result of that. It's just a phenomenal field to be involved in, and it's so simple. The adjusting is so simple. You just got a lateral here, stick your finger on the lateral, there's the pain finding, boom. Pre-test it, go and do the pre-testing, make sure that's what's doing it, and away you go. But the one thing I want to ask you to do as we leave and wrap up for the day, don't trivialise, don't marginalise any joint in the body as having greater or less importance than any other joint in the body. It just isn't true. An atlas has no greater significance in adjusting than a sacrum, and the sacrum has no greater significance in adjusting than a metacarpophalangeal joint or a hyoid or any other bone. The significance of this, people, is it's the right place at the right time with the right force. That's what will do the job and produce some pretty wild stuff for you. Now, having said that, I'm not asking you to be erratic and just jump around all over the place, because that'll get you into trouble with this whole thing. You've got to stay systematic. You don't want to go, oh, this stick, I've just found this thing in the wrist, oh, we'll just give that a bit of a go, you know. Get the activator on it and give it a click and it'll be okay. Break that mentality. Your patients deserve far better than that. You're going to start with the top and work down every time. Never change the system. Always systematic, one thing after another. Follow the logic and it'll lead you to the right place. It might take a little bit of time in some cases, but not too much. It'll lead you to the right place and away you go. So can a colicky baby have colicky symptoms because they've got a rotated finger? Absolutely 100% yes they can. And you never want to stop, you never want to fall into this idea of, oh, I got colic, so we'll adjust second and third thoracic. That's crap. What you're going to do is make an intrusion into the nervous system that'll give you the best cortical balance that you can possibly get. That's what you're going to do. And that will give you the best result every time.